This rose symbolizes my pure intention, that's why its color is white. And the thorn symbolizes the trials or challenges that we can encounter.
Oh, so very...
It's also long.
Siya yata yung nag-break. Oh! Ay, so sorry.
I have a gift for you. Baka late pa yun. Go give out.
Did you know that a cut from a thorn of a rose may lead to a disease? Really? Did you know that a cut from a thorn of a rose may lead to a disease? Sporotrichosis is an infection caused by the fungus Sporotrichosis.
The fungus lives throughout the world in soil, plants, and decaying vegetation. Cutaneous or skin infection is the most common form of infection, although pulmonary infection can occur if a person inhales the microscopic airborne fungal spores. Most cases of sporotrichosis are sporadic and are associated with minor skin trauma like cuts and scrapes. However, outbreaks have been linked to activities that involve handling contaminated vegetation, such as hay or wood. Farmers, nursery workers, landscapers, and gardeners are at higher risk for the disease because of their chance of cuts or puncture wounds while working with soil. People who are immunosuppressed are also at higher risk to get the disease.
Cutaneous infections are most common and are subclassified into fixed cutaneous and lymphocutaneous. Fixed cutaneous infections occur at the site of inoculation and remain confined entirely to the skin. Lymphocutaneous disease results from lymphadengitic spread of an infection. Satellite lesions develop along the path of the lymphatic vessels and associated lymphadenopathy occurs. Extracutaneous or disseminated sporotrichosis can present as pyelonephritis, orchitis, mastitis, synovitis, meningitis, or osseous infection. Sporotrichosis can cause a monoarthritis, typically involving the knee. Many affected individuals are immunosuppressed by alcoholism or HIV infection.
Thorns or other mechanisms, the disease takes days or months to develop. The first symptom of sporotrichosis is a firm bump nodule on the skin that can range in color from pink to nearly purple. The nodule is usually painless or only mildly tender. Over time, the nodule may develop an open sore that may drain clear fluid. In other instances, masetomas may be formed. Masetomas are areas where sinus tracts are formed from the lymph to the skin surface and discharge granules containing masses of organisms that cause the infection. If left untreated, the nodule and the ulcer become chronic and may remain unchanged for years. In about 60% of cases, the fungus spreads along the lymph nodes. In very rare cases, the infection can spread to other parts of the body. The disease can infect the bones, joints, lungs, and tissues surrounding the brain. Such spreading usually occurs only in people with a weakened immune system. The widespread infections can be life-threatening and are difficult to treat. The symptoms are progressive. Initial signs of infection are not visibly distinctive. As the infection progresses, lesions develop, often appearing in a line as successive areas of the lymphatic channels become infected.
Treatments for sporotrichosis, it all depends on the site infected and the person's overall medical condition.
Infections in the skin only. These infections have traditionally been treated with saturated potassium iodide solution. This medicine is given 3 times a day for 3 to 6 months until all the lesions have gone away. Skin infections may also be treated with itraconazole for up to 6 months. Infection in the bones and joints. These infections are much more difficult to treat and rarely respond to potassium iodide. Itraconazole is often used as an initial medication for several months or even up to a year. The drug amphotericin is also used, but this medicine can only be given through an IV. Amphotericin has more side effects and may need to be administered for many months. Surgery is sometimes needed to remove infected bone. Infection in the lungs. Lung infections are treated with potassium iodide, itraconazole, and amphotericin with varying amounts of success. Sometimes the infected areas of the lungs have to be surgically removed. Infection in the brain. Sporotrichosis meningitis is very rare, so information and treatment is not readily available. Amphotericin plus 5-fluorocytosine is generally recommended, but itraconazole might also be tried. Itraconazole should not be used in pregnant patients. Treatment in pregnancy and of children usually requires consultation with infectious disease specialists. Alternative treatments for cutaneous sporotrichosis are mentioned in the lay literature. Fungicidal herbs applied directly to the infected skin are supposed to treat the infection. However, there are few research data to back up these claims.
Yes! Where is he? Genius!
Take a break, have some Dunkin' Donut.
I'll get you! Huh?
Hi.
Hi.
What's that?
Nothing.
Can I see?
No!
But... No! Hmm. Aww. Hey, I'll trade ya. Gimme! Huh? Ah! Mommy! Mommy! Mommy!
Hey.